Meeting to order. Please be seated. We continue with debate under item number HES1, Policy, Advice and Ministerial Services, Health, Environment, Culture, and Housing. Continuation of questions. Member for Bodden Town West.
Thank you, Mr. Chairman. Through you, sir, to the Honorable Minister, just looking at this particular vote, I noticed it includes MHE7, which is included in the budget and output statement. And just looking at MHE7 that deals with governance, just looking at MHE7 that deals with governance, and especially with particular to the statutory authorities, namely the Health Service Authority, Cayman Islands National Museum, National Gallery, and Cayman National Culture Foundation. I was just curious in terms of what is the process or what is the procedures that the ministry undertakes to basically take a closer look and look at the governance structures with these particular entities and how it relates, especially as it relates to the Public Authorities Law. Thank you.
Mr. Chairman, Nellie Pucci, Acting Chief Officer of the Ministry of Health, Environment, Culture and Housing. Mr. Chairman, through you, I can't speak to what the previous policies may have been at this point, but I can say that the ministry does have an appointed board representative on all of the statutory authorities who will be present to report back on certain conditions that are occurring on these boards and to be that ministry rep to ensure governance is carried out.
Through you, Mr. Chairman, is it one person that sits on all of these boards, or is there several people that sits on these boards?
Mr. Chairman, through you, there is a named ministry rep for each board.
Thank you. Through you, Mr. Chairman, well, what I'm trying to understand is when all of those reps sit on the board, do they then come back and report to the minister in terms of what is happening on those boards that he should be aware of?
Mr. Chairman, through you, as I said, I can't speak to what's happened in the past. It's certainly something that will happen going forward. We know that we get some monthly reports from our HODs and from these boards in particular. Those are reviewed at the policy level and minister will have sight of those. But to say that we have all of the minutes coming back and they're going straight to the minister, I can't definitively say that at this point, but I can say that it is something certainly that would happen under my watch.
Thank you very much for that. The reason, Mr. Chairman, through you, and let me explain to you what it is I'm getting at. One of the things that we have already determined in this honorable house is that based on some of the things that have happened in the past, it appears as if though there's a disconnect between information reaching the minister, and I don't want to get into all the different examples, and what we don't want in this situation, because ultimately the minister is a representative via the premier and then via this honorable house in terms of managing this portfolio or this particular issue. And what we need to make sure is that the proper support and governance structure is in place so that the ultimate decision maker, in this case the minister, then ultimately to the cabinet as the executive in charge of the country, is receiving the information that is supposed to be receiving. And it is that disconnect that we're trying to find out at this point. Because as the old saying goes, most people know what they know, they don't know what they don't know. And what we're trying to understand is what does the public service have in place to ensure that the political directorate, in this case the minister, is aware and abreast of what is going on. So I understand that the acting chief officer is new in the post, but recognizing that this is over $100 million, at least I like to have the question in all of this then is what then does the acting chief officer sees as the steps to be taken to ensure that the minister is kept up to breast on these important issues?
That's a very good question, Mr. Chair, and in fact, I'll allow the acting chief officer to answer, but is one of the things that I was most uncomfortable about in not receiving that kind of information, and it was one of the first things that we discussed as she was selected. It was a problem, but she's already started writing a policy on this. I'll allow her to.
Mr. Chairman, through you, as Minister mentioned, this is one of the areas that I've noticed just in my short time that is a gap for us. It's how we make sure that the information that's happening, the activity that's transpiring at the board level, how that information feeds back to the ministry and then to the minister in a format that he is able to quickly or easily glean what's transpiring and what are the hot issues that really need his input and attention. So through more regular meetings, through regular reporting, through having minuted discussions and occurrences at these meetings being fed back to the minister, those are some of the initial steps that will be taken to bridge the gap.
Mr. Chair, can I just quickly ask, are we saying that the former chief officer never used to inform the minister about these very important matters?
It's a very good question, and I would prefer not going there. I think I've said enough. We don't need to beleaguer the past. I think everyone has a different style of managing and prioritizing things. So that's styles of management.
Thank you, Mr. Chairman. Through you to the Honorable Minister, as my colleague from Northside had discussed in terms of the increase in staff costs, the increase in costs year on year on this particular vote, through you, can the Minister or the Acting Chief Officer advise what is driving the increase in costs year on year?
Mr. Chairman, through you, with respect to this vote, we went through what the additional costs were for this particular year. Am I being asked to restate those, or is there something else? Okay, with respect to 2020 and 2021, similarly, the main drivers of the additional costs in this output item relates to the long-term residential mental health, the operating costs, and also consultancies for ISWIM, $800,000. The operating costs were $1 million for mental health and $285,000 for consultancy.
Mr. Chairman, through you, and I just wanted to make sure before I went to this other area, one of the things I am concerned about as we go through the budget statements and you look at this particular ministry, and just to put things in context, I am looking at the annual HR report 2018 that was published, that was developed by the portfolio of the civil service, and just looking at the different ministries. The Ministry of Health actually has one of the lowest complements of staff. And when you look at that compared to responsibility, the question to the minister is, do you have sufficient staff in place to ensure the proper governance of all the different boards and statutory authorities and committees that this ministry falls under. Because compared to other ministries and what is required, Mr. Chairman, through you, this amount actually looks inadequate, and I would like to get the minister's opinion on that. Thanks.
Mr. Chair, and without the relevant study being done, I mean, I can only tell you the comments that I get from the staff. It's a lot of pressure. It seemed to be very short staff. I'm not happy with the compliment at this time, and that's one of the undertakings that the new acting chief officer is also doing, gathering information on.
Well, thank you very much for that. Through Mr. Chairman, I can say to the minister, I have dealt with the acting chief officer before when she was in a different capacity, and I found her to be professional and quite diligent in terms of what it is she does. So I do have some level of confidence, knowing her background, that she would be able to probably deliver this. But I must state for the record that looking at the overall governance model that is in place, I do have concerns in terms of for a ministry this important to the country and what is required, and also considering what came out of the Auditor General report when she did look at the delivery of healthcare in the Cayman Islands. This is one of the areas that really needs to be addressed, and we already saw the effects of it, with which we'll deal with in a second vote with the Health Insurance Commission, and information not reaching the minister and eventually not up to cabinet where decisions could be made. So I know other members have questions, so I will cease for now and give others a chance.
Mr. Chair, I just want to add that when I came on in May 2017, it was one of the first things I recognized that, and I stand to be corrected, but I think it is correct to say that we were the only ministry that didn't have two deputy chief officers, and yes. So I fought hard, and the chief officer at the time, we won the battle and got approval for that extra position. So that should be filled by the acting chief officers as soon as possible, and other posts that are available.
All in favor of HES 1, Public Advice and Ministerial Services, Health, Environment, Culture and Housing, $7,966,314 in 2020 and $9,156,886 in 2021. Standing part of the schedule to the bill, please say aye. Those against, no. Ayes have it. HES 2, Health Regulatory Services, $1,734,503 in 2020 and also in 2021. Are there questions? Okay, I'm going to start down here and make my way up. 1, 2, 3. Member for Northside.
Through you, Mr. Chairman, I noticed that there's a 30% reduction in this vote, and I wonder what regulatory services are going to be cut back, because the numbers don't indicate that there's going to be any cutting back and what they expect to do.
Mr. Chairman, through you, in response to the member's question.
Can I just ask you to state your name and your position again for me,
Yes.
please?
Yeah, Mervyn Connolly, Director of the Department of Health Regulatory Services and Superintendent of Health Insurance. So the question in regards to the allocation for the 12-month period 2019, as indicated, Mr. Chairman, it appears that this was a typo in regards to the 2,468,000. That number should have really been 1,442,000. Yeah. Yeah.
Okay, through you, Mr. Chairman. I noticed that under the description, the first item is investigate and resolve complaints. But on the quantity, there's no indication of any reference to complaints. Can you give us an idea of how many complaints you get from the general public against the health insurance companies?
Through you, Mr. Chairman, on a monthly basis, we receive approximately 500 complaints a month, and the majority of those complaints are really in regards to policy terminations, meaning that employers have not really paid their premiums to continue the coverage for their employees. The number of complaints against the approved insurers, out of the 500, they would be really less than 10 per month. And those type of complaints are usually related to the health insurance company not processing claims in a timely manner.
You also manage the segregated health insurance fund. When was the last time that was increased?
So the last time that was increased was 2013. Yeah, through you, Mr. Chairman. Yeah, 2013, and it went from $5 to $10 for each individual that is covered, and $10 to $20 for each group, each family group that was covered.
Is the fund that is being collected meeting the demand that is placed on the fund?
To the best of my knowledge, Mr. Chairman, through you, the fund on an annual basis is collecting a little bit over $5 million. And as I understand it, that the latest expenditure to provide health care for indigent persons is closer to $35 million.
And that balance has to come out of the government revenue, either through a whole slew of individual funding mechanisms that exist in this budget, or through upgrades with Cineco.
I don't know if I could speak to that. I think that the actual funding, the additional funding is actually provided through the Ministry of Health.
Yeah, but it's in this budget in 5 or 6 different heads, so it makes it almost impossible to track it, and to hope nobody will add it up.
That would be a reasonable, yes.
Yeah.
Sir, Mr. Chairman, before we move off of this topic, if it's okay with the member from Northside.
Sure.
Can, just for the purpose of the members and listening public, can you tell them when this fund was set up, why it was set up, and the purpose that this fund was meant to, what it was meant to achieve?
Sure. Through you, Mr. Chairman. So the Health Insurance Commission Law 2003 actually establish the segregated insurance fund. And the purpose was to help offset the cost of the medical care that was being provided through government for medical indigent persons. So those persons have to actually go through the Department of Children and Family Services. That's the initial application. The assessment in regards to their meeting the criteria to obtain the assistance is actually done through the Needs Assessment Unit. And the Health Insurance Commission actually collects the monies for the contributions paid by the insured persons.
Thank you very much. Just as a matter of clarification, at the time when it was set up, was it envisioned that the fund would have covered roughly 50% of the cost at the time to take care of the medical indigent population at that time?
Through you, Mr. Chairman, I wouldn't be able to say the exact percentage, but it would be fair to say that it was intended to cover, let's say, a larger percentage of the cost than it's doing right now.
Through you, Mr. Chairman, and this was generated as an alternative for the private health insurance carrying high-risk people in their pools, or because they don't cover indigent people. So why was it tacked on to individual health insurance premiums in the private sector? Because this is a pass-through to the client, right? The $5 and $10 is added on by the insurance company to whatever they determine that premium should be based on the requirements of the law.
Through you, Mr. Chairman. So we're actually speaking to two different issues here. One is the fact that the contributions for the segregated insurance fund, the premium rate for the standard health insurance contract is actuarially determined, and the $5 and $10 previously, and now $10 and $20 is a part of the standard rate that is established under that. The fact that we have persons who are unable to afford the cost of their medical care, and sometimes it's just for a particular episode of illness. In other words, that condition or the illness could be for a duration of, 6 months or less. So we're dealing with two different issues. One, that this fund is set up to help offset the costs generally. And then we have individuals who, because of their medical conditions, not so much their pre-existing medical condition, their medical condition at that time would need assistance from government.
But that usually arises because the health insurance industry managed to convince the government to put episodal limits on events that happen during your lifetime.
Through you, Mr. Chairman, there was an amendment to the health insurance legislation in 2013, which really requires all of the approved insurers now to accept persons who may have high-risk medical conditions.
Yeah, no, that's not what I'm talking about. It is not normal internationally for private health insurance to carry lifetime limits, annual limits, and a third level of episodal limits. Mm-hmm. And I think the law envisages an episode as one event at the hospital or one visit to the hospital.
That would be true, yes.
Right. So my question is where did that idea, was that generated by your agency as a concern, or was that something that the private insurance asked for?
I think going back to the genesis of the health insurance legislation, obviously we did have stakeholders, including the health insurance providers, who obviously was part of, putting together the legislation. So I can't necessarily speak to precisely what was the mensa behind that, but what is fair to say is that we're always cognizant of trying to manage the availability of benefits that are made available and the cost of the premiums that is going to be charged for that particular plan of benefits.
But can you say if the introduction of these episodal limits resulted in a reduction of premiums for the same plan?
Through you, Mr. Chairman, the reduction, I think it's a way, again, of trying to certainly manage the claims that are being provided and being processed. And I think that's pretty much the extent that I could respond to that question.
The Health Insurance Commission has no remit to evaluate or investigate health insurance plans in the private sector other than what you call the SHIC plan, right?
Standard health insurance.
Yeah, the standard health insurance plan,
yeah.
right? So if I buy a better plan than the standard health insurance plan, your commission has no authority to investigate that plan, even if I complain to you that I am not getting the coverage that I am paying for.
Through you, Mr. Chairman, yes, we would be able to investigate complaints in regards to supplemental benefit plans. We would be able to, first of all, verify that those level of benefits were indeed covered by that plan, and if so, the Commission could instruct and would and has done so in regards to the health insurance company honoring the agreement in regards to providing those benefits under those supplemental plans.
But you have no influence over the premiums beyond the standard health insurance.
Through you, Mr. Chairman, that is correct. Yeah, we do not regulate the premium rates for the supplemental plans.
Do you have the authority to regulate the private industry to make sure that people are only charged with additional benefits above the standard health insurance plan? Because that everybody starts at that rate for this plan, and there has to be an evaluation that includes that and the add-ons up the stream.
Yes, so through you, Mr. Chairman, every single plan of benefits that is sold in the Cayman Islands must have the standard health insurance contract benefits enshrined in that plan. So it would be correct to say that, once that base is established, then you could certainly add additional benefits onto that. And I think the member would be correct in saying that those additional benefits that are added on, the premium that is charged for those additional benefits are not regulated by the Commission.
The fees that you charge healthcare professionals, how are they determined? In other words, you have a fee for a doctor, you have a fee for a dentist, you have a fee for a dental assistant. How are those fees determined?
Through you, Mr. Chairman, I think the member would be referring to the standard health insurance fees.
No. We're talking about your regulatory function under the health practice law. Under the health practice law, forget the health insurance. We moved away from that now.
Right.
Under the health practice, various health practice laws, you manage the issuing of license based on board decisions, whether it's physicians or nurses or pharmacists and other professionals. Right? Each one of those carries a fee. How is that fee determined?
Through you, Mr. Chairman, those fees in regards to the registration and licensing of practitioners, the way that those fees are really determine is through pretty much how much labor and how much other administrative work has to go in to provide that level of service for those particular duties.
Would it be reasonable to assume that the time and effort and the kind of certification and that you have to check out for a doctor is somewhat more than it would be for a dental assistant?
That would definitely be correct.
Okay.
Yes.
Well, I think you need to look at your fee structure, because I think you're currently charging a dental assistant the same for an annual license as what you're charging a doctor.
Yes.
And I think that I agree with your rationale, but I think that you need to look at the whole fee structure, because there are also other professions that are being charged the same as doctors, and I think it's fair to say that if you need to investigate a doctor certification, et cetera, it takes more effort than some of the para-professionals.
Through you, Mr. Chairman, I think we would certainly agree with that point. The level of due diligence and vetting would certainly be much more for, a higher level practitioner.
Okay, good. Member for Savannah.
Thank you, Mr. Chairman. First of all, I'd like to throw you to Mr. Connolly to thank him for the many years of administrative service that he's done for healthcare in the Cayman Islands. When I was first dumped into a ministry by Michael Gore 27 years ago, he was a great assistant and good help to me and the ministry. Just a couple of things. Back then, it was not kosher for doctors and medical clinics to do advertisements. Every time you're on the radio now, it's just as much as what Foster's ads and Kirk's ads and Hurley's ads and stuff. I don't know what caused that trip. I don't know how you decide which doctor to go to, but I know at one stage it was not something that the doctors would complain if someone made a mistake and put something in the paper saying they were offering certain services. I don't know how it got to the stage where it's at now.
Through you, Mr. Chairman. Thank you, Honorable Member. You are correct. Back in the day, the constraints on advertisements by healthcare providers, including healthcare facilities, was obviously quite, it was restricted. There have been some changes over the years, and I think it has been relaxed to some extent. And I think, your observation is fair that, the type of advertisements that we have now in regards to healthcare providers, it looks as if, that certainly it's fairly laxed. But I know this is something that the Health Practice Commission has certainly noticed, and I would want to think that they're going to address that going forward.
Thank you, Mr. Chairman. Just continuing, in registering some of the practitioners, and I'm specifically referring to OB gynecologists, it has been suggested to me over the years that for the population of the Cayman Islands, I think it's 9 or 10 we have, normal and anywhere else in the world, most you would have be 1 or 2. I understand that it's for whatever reason, and there always seems to be some excuse to perform C-sections, and I don't want to be accusing anyone, but how is this monitored? Does this come in a ambit of your the observations when this is brought to your attention? And part of the same question, when you register the doctors from wherever they are the credentials verified from their original place where they practice?
Through you, Mr. Chairman, if I could respond to the latter question first. I want to certainly assure this honorable committee that every practitioner that is practicing in the Cayman Islands, that they are properly vetted, meaning their qualifications, and that they would have met the criteria that are set down by the individual councils. In this case, for medical and dental practitioners, it is actually the responsibility of the Medical and Dental Council to ensure that that's the case. And then going back to your previous question, I can't say whether there have been any complaints in regards to the practice of the obstetricians, gynecologists, but it's something certainly that if needed, I could undertake to see, whether there are any complaints. But to the best of my knowledge, the Medical and Dental Council has not received any specific complaints related to that.
And maybe you could compare the statistics, through you, Mr. Chairman, to the honorable person, to compare the statistics with other parts of the world to see, because I was told at one stage it's kind of high.
And through you, Mr. Chairman, that isn't to the member. That is specific to the number of C-sections that are being performed. Okay.
Through you, Mr. Chairman, just to intervene, there was a policy that C-sections at the hospital had to be certified by 2 obstetricians, board-certified obstetricians, as to be medically necessary. Is that policy no longer in place?
Through you, Mr. Chairman, I would not be able to respond to that question as I don't have that.
Mr. Chairman, through you, Lizette Yearwood, CEO of the Health Services Authority. The policy of the HSA is that a consultant must be involved whenever there's a C-section involved, and I know that there has been quite a feeling that there has been a high C-section rate, and it is something I know that the Medical and Dental Council has been investigating, because they have asked us for information in order to be able to assist them. But I think that sometimes, the practitioners are erring on the side of caution due to the litigation that can come out of something going wrong if they were to wait and try to do a normal delivery, because that has happened in some cases where they do try to proceed with a normal delivery and there is a poor outcome. Then there's litigation involved, and obviously a young life that's affected going forward. But it is something we're mindful of, member, and it is something that is reviewed by our peer review committee amongst the physicians.
Mr. Chairman, you mean tell me we have that many possibility of complications in pregnancies in this country now? Is there a propensity to have complications nowadays? Yes, that's all I'm asking.
Mr. Chairman, through you, I'm not sure what the question is, but obviously with every delivery, there is a possibility for complication.
No,
and
I believe, I thought I heard you say that the physician errs on the side of caution for fear of complications. So I'm asking if that is that high nowadays, and maybe what's causing that. I don't know. Some deficiency in the food here? What?
Mr. Chairman, through you, our statistics as far as maternal mortality and morbidity is very good compared to the region and globally. But what I'm saying is where there's a high-risk delivery, the physician will err on the side of caution. Rather than trying to progress a normal delivery, they will go to a C-section, because obviously the life of a child is going to be the outcome such a decision.
That's precisely my point. Is it that high that we're having all these complications? Why we're having the high percentage of C-sections? I mean, the mortality rate here is extremely good. So why are we having all of the C-sections if it's not used as a selective surgery and birth date, so to speak?
Through you,
Member
Mr.
for
Chair.
Georgetown Central.
Thank you, Mr. Chair. Through you. Through the minister, I heard the Commissioner for the Health Insurance Commission say that, you know, every medical practitioner is fully registered in the Cayman Islands, and that's a good thing to hear. I just recall some dilemmas with the healthcare provider in the eastern districts. Can we safely say that that's all resolved now in respect to their credentials? Because I remember there being some special requirements specific to that hospital as opposed to the other providers. Is that still the same in respect to Health City?
Can you, sorry, Mr. Chair, can the member from Georgetown Central either repeat or rephrase? Thanks.
Through you, Mr. Chair, it is my understanding that the members, the health service providers at Health City had a different requirement than other health practitioners. Is that still the same, or I know that the Health Insurance Commissioner just said that everybody is up to par. I just wanted to know have we ironed that all out by now, and what's the update?
Carlene Webb, Deputy Director for the Department of Health Regulatory Services. Through you, Mr. Chair, if I understand your question correctly, are you trying to determine if there's a difference between institutional registration versus other practitioners? Okay. So for institutional registration, the requirements in terms of their qualifications, licensing from the 7 jurisdictions are the same. The only difference is that for the institutional registration, they can come from other jurisdictions other than the 7 that are recognized by our jurisdictions. So those 7 would be the US, Canada, South Africa, the UK, Australia, New Zealand, Jamaica.
Thank you. And just for note, I want to say that the services that I've received and many people in my constituency have received from Shetty Hospital has been fantastic. So just to make sure that is public knowledge. In respect to, thank you so much, ma'am. In respect to the number of insurance violations to the minister or that have been reported, have we seen an increase or a decrease from the last couple of years?
Can, Mr. Chair, can a member say what type of
Health insurance.
Yeah.
Through you, Mr. Chairman, health insurance, could I clarify, health insurance complaints against healthcare providers?
Yes, correct.
I think the numbers have been fairly consistent over the years. Yeah.
Thank you. Just for a matter of this understanding of this committee, if a person has a complaint, how do they handle that, and what's the procedure for them to make the complaint, and what normally happens?
and this, through you, Mr. Chairman, could I clarify? So this would be a complaint against a healthcare provider? Yeah. So the process is that the department would receive the complaint in the first instance. We would obviously want to verify that it is a complaint that is definitely substantiated, and that there is some information which could be documented, which then goes to the council. So then the complaint itself is actually presented to the Medical and Dental Council. The Medical and Dental Council, if it's a medical or dental practitioner, would then make a determination on how that complaint would be treated.
Thank you. Just to follow up on that, if a Caymanian started to work for a company and you know that there's some jobs that don't always have contracts, particularly with the trade industry, because they're for periods of time. If there's no contract and they just agree to say, I'll work on this job for the next year or what have you, and the company withdraws the monies necessary for insurance, how would a person prove that that there is a violation if they have no contract for working for the company? Do you have situations like that?
Through you, Mr. Chairman, under the health insurance legislation, an employer is required to maintain records in regards to the provision of health insurance for the employees. So if an employer is failing to maintain those records, that would be a violation. That would be a breach of the health insurance law.
Thank you for that, Mr. Conley. But let's say, for instance, a malicious employer, and I'm not going to dwell on this too much longer, but a malicious employer just says, well, I don't have any contract, I can just say I never employed them. Is there a way for you to say, okay, then check to see, was there any payments for salary which would indicate that, yes, they were working? Do investigations go that far?
Absolutely. Through you, Mr. Chairman, yes, we would.
Thank you so much, Mr. Conley. Through you, Mr. Chair, to the Minister, is there a dental surgeon currently contracted or currently on board for the HSA at the moment? Dental surgeon.
Mr. Chairman, through you, currently there is a vacancy for that position, and we're in the process of recruiting for the dental surgeon that would do facial maxillary work.
Thank you. Through you, Mr. Chair, is that for a full-time post or temporary post? Through you, Mr. Chair, I think maybe she may have been distracted. Is that for a full-time post or for a temporary post?
Mr. Chairman, through you, that position was on a visiting basis, but we're in the process of looking for somebody full-time.
Thank you, Mr. Chair. I'm finished.
For Georgetown, for Boddentown West.
That's okay, Mr. Chairman. Thank you very much, Mr. Chairman. Through you to the Honorable Minister and on to the Health Insurance Commissioner. Looking at this particular vote, HES2, included in the general output, it comprised of HRB 15, which is policy advice and reports to the Health Insurance Commissioner, Board and Ministry. This basically, the expenditure deals with the policy advice given to the Ministry. One of the things I'm curious about, Mr. Chairman, and through you, is that looking at the current budget, and you look at NGS 55 and HEA 2, when you look at those two votes in particular, you will see that for 2018 and 2019, the public purse incurred $102 million, which is roughly a little over $50 million a year on average. And looking at the CMA's report, where if you look at the industrial sector, you will see that they're doing around $15 million a year in profit. With that said, Mr. Chairman, we have a situation where over the next 10 years, just maintaining figures without any major population growth, the country would have spent $500 million on these two votes, and insurance companies would have $150 million in profit, and the country would have bared $500 million in costs. With that said, and bearing in mind the previous answer from the Health Insurance Commissioner that the current plan, I think it was the SHIC plan that they were talking about, where the benefits for that was inadequate. The question in all of this, through you, Mr. Chairman, is what advice ultimately will the Health Insurance Commission give to the ministry and ultimately onto the country of what we need to do to deal with this issue? Because in 10 years' time, at this rate, we'd have gone $500 million in costs, and insurance companies that just deal with healthcare would have had $150 million in profit, if not more, because we have brought in a cherry-picking model. And as we can see, the segregated insurance fund, what it was set up to do initially isn't achieving that mandate. So the question is then, where do we take this from here? Because this is clearly unsustainable. And I think the Premier himself has also alluded to that in his budget address. Thank you.
Through you, Mr. Chairman, in response to that question, I think it was mentioned earlier that we are about to actually set up a committee of all stakeholders in regards to looking at the way forward to provide some recommendations to the Honorable Minister. Obviously, one of those considerations will be looking at the provision of national health insurance. So I think that is the way that we're going to be moving in the short term.
Mr. Chairman, can I ask the Minister to consider that the same individuals would pitch this ill-fated SHIC 65 plan to him not be included on that committee? Because one of the purposes of insurance is to spread risk. And it was beyond me how it is that you were going to take one of the most vulnerable areas of the industry and try to maintain risk there without normal, healthy people paying for people at a different stage. So I'm very happy to hear that you're looking at that. But ultimately, at the end of the day, this is something that needs to be looked at quickly. And the Minister may also recall that one of the very first motions that we had brought to this Honorable House was for the establishment for the House to set up a committee to start looking at this issue now. So I'm hoping at least at a minimum, if we can even also consider, if the Minister would consider even having a committee of other members of the House to deal with this issue, because this is no longer a political problem, this is now a national problem. So it's something for the Minister if he would consider that. Thank you.
So, Chair, I think as a country and all of us here, the fraternity of MLAs, we all need to be concerned with this. And I invite the opportunity to have input from all in the House.
You want me?
Member Freeston.
Thank you, Mr. Chairman. This one is to the Commission as well. I'm still interested in what we're doing with companies that are not paying insurance for their employees.
Through you, Mr. Chairman, under the Health Insurance Commission, we do have the facility of administrative fines, meaning that where there's strict liability, meaning that there's clear evidence that the employer did not provide health insurance for their employees, then those type of case files can be dealt with administratively at the Health Insurance Commission. And we have been definitely prosecuting offenders using the administrative fines system.
Do we see a lot of it, or?
Well, if I could just say that certainly over the past year or so, we have issued 12 administrative fines, and a total of 8 is in the process of being considered for action with the Director of Public Prosecutions.
And how many others you have outstanding, or is that it?
And the first efforts of the commission is to actually get compliance. So if we can get that employer to obviously comply with the law, then that is our first effort. Where we fail to get the cooperation and compliance, these are the cases then that are further dealt with by the administrative fines, and obviously if needed through the Director of Public Prosecutions.
Yeah, but so you don't have any complaints outstanding then? They're all either settled or going to court?
Well, there's always complaints that are in the process of being, resolved. But by and large, we set very specific timelines. Once there is evidence to prove that there has been a violation, we'll set very specific timelines, and that is usually within 4 to 5 days to get the compliance before we then pursue further action.
So you don't have any on the active investigations other than the 12 and 8 that you just spoke of then?
No, Mr. Chairman, that through you, sir, that would not be correct.
But that's what I'm asking. What is on the active investigation, those that are outstanding, that hasn't been resolved yet, one way or the other?
Okay. So based on our latest statistics in regards to those number of complaints, we have somewhere in the region of 43 or so complaints that we're looking at.
That's not bad. We heard about hundreds in the pension.
And I'm pleased to say that I think through the efforts of public education, the Commission has done a lot of work in regards to going out and meeting with employers and really trying to point out what is required under the law. So we're using, obviously, the educational part, trying to get employers informed, as well as using, the punitive and meaning that, we'll take action against you if you don't get compliance. So over the years, I think, we have seen improvements in regards to employers complying with the law.
And your compliance objective is moving forward to start paying what was for that employee that they have not paid for whatever period of time. Is that your objective?
The objective, yes, is to get the compliance, provide the cover, and if there were any uninsured medical expenses, that those expenses would also be covered.
Right. So it would be fair to say that what they didn't pay prior to that, haven't taken it out of the employee's wage, is a fraudulent act.
That is correct. That would be part of the restitution, and they would definitely be required to repay the employee any monies that they may have deducted without having the adequate coverage in place.
Okay. So you don't pressure them on fraud then, you just make them pay it back.
Unless,
they're fortunate.
Yeah.
Member for Northside.
Through you, Mr. Chairman, I think under the previous head was indicated that the health practice laws were being reviewed and replaced. Is there any policy consideration to expand beyond the 7 countries that we currently accept doctors and other professional registration from?
Through you, Mr. Chairman, to the best of my knowledge, I don't think that is something that is contemplated at this time.
All those in favor of HES2, Health Regulatory Services, $1,734,503 in 2020, and $1,734,503 in 2021. Standing part of the schedule to the bill, please say aye. Those against, no. The ayes have it. HES 7, collection, recycling, and disposal of waste. $6,097,107 in 2020. $6,279,388 in 2021. Are there any questions? Member for Northside.
Thank you, Mr. Chairman. I wonder if the minister could say how many new garbage trucks have been ordered for delivery during this budget cycle.
Mr. Chair, I'd like to thank the member for the question. We'll allow the director to provide that information. Take your time.
Good afternoon. Richard Sims, Director for the Department of Environmental Health. Through you, Mr. Chairman, we've ordered 11 garbage trucks for the ensuing financial term. They're broken down as follows: 5 rear loaders, 3 front loaders, 2 roll-on roll-offs, and 1 grapple truck.
To you, Mr. Chairman, are any of the existing trucks expected to be in use with these 11 trucks?
Through you, Mr. Chairman, yes, some of the current trucks will be used during our operation.
What would be the total number of trucks available for use?
Through you, Mr. Chairman, we currently have 14 trucks, and 8 of them are pretty much in good condition. The rest will be pretty much retired.
So you're looking to be able to operate 19 trucks?
That's good.
I have
Thereabouts, at least 21.
Pardon?
At least 21.
21, okay.
Yes.
I've been looking through the various documents to try and find what is your increase in staff complement. Unfortunately, in that book, it's all blank, so I don't know. I mean, we've been going through this all week, that these numbers just don't seem to mean anything, Mr. Chairman. How many new staff members are you getting to operate these 11 new trucks?
Mr. Chairman, through you, we are seeking to increase our staffing by a total of 12.
12.
That's total of 12, but in terms of drivers for the garbage trucks, we're only getting 4 out of that.
So, Mr. Chairman, correct me if I'm wrong, but to operate a garbage truck safely, you need a minimum of 3 people. 1 driver and at least 2 sidemen. So where is the 33 staff coming from to operate the 11 new garbage trucks? Because in fact, you're going to need more than 33. Because if you got 33 people and they all getting 2 weeks vacation, that's 6 or 6 weeks vacation per year. So you're going to need another 3 staff members, because at any one day work day, there are going to be 3 people on vacation. They're entitled to 10 days sick leave. So you got the same situation. At any one day, it's possible for at least 3 people to be off legal or sick. So you're going to need a minimum of 39 people to operate these garbage trucks for 1 8-hour shift per day. And the country needs 2 shifts if you're going to comply with the law and pick up garbage from households as is required by law twice a week. But he not got enough to operate the trucks in God now, because every time that we get in a crisis, we see an announcement by the deputy governor that he's giving him 10 people for 2 weeks, temporary, to get over the hill, and then he goes back. The problem is not vehicles, it's staff, because if you have 8 vehicles that are in good condition, and you had the 30 people necessary to run them properly, they could operate 3 shifts. The truck can be driven 24/7. Take it out one day for maintenance or something.
Mr. Chair, the member is on to something, and you know, at times we must admit, and I can tell you though that the director is actively trying to ensure that he has the correct complement. At the moment, no, we don't have reliability in vehicles. When we get the new vehicles, which we've got some of the vehicles already, that some of the smaller vehicles we've got already. The garbage trucks are due to arrive about February or March. So once those new garbage trucks come, then we'll have reliable vehicles. At that time, the government is committed to ensure that the department has the adequate amount of staff to operate these vehicles, to ensure that we have efficiency and above.
To you, Mr. Chairman, can the minister point to this budget where those people are provided for? I just go and hire people if you don't get the money provided here in this budget. Chairman, the reason I'm asking that question is, I don't want to sound silly, but the information is not here. The numbers are blank. I mean, I can read the whole page if you want.
I agree the numbers is not here, and so is the garbage trucks.
But Mr. With respect, Mr. Minister, if you don't get, so you plan to call another finance committee to authorize funds for staff to operate these trucks when you get the trucks? Back up to the
Yeah, thank you.
To the director, okay.
Thank you, Mr. Chair, and the member for an oversight. What I will allow the director to do is to elaborate on the staff complement that he has now, so that we can at least have that established in this house.
Okay. Tell me how many trucks you got operating now and how much staff you got.
Through you, Mr. Chairman, to the member. Currently, my staff complement across the DEH is 100 and...
No, but I know all I want to hear about is the driver for the garbage truck and the 2 side men.
Okay. Through you, Mr. Chairman, the driver complement at the current, as it stands currently, is 16.
16 drivers for how many trucks?
For the 8 trucks.
For 8 trucks.
Yeah.
How many, I don't know what you call them, assistants or?
For the driver's assistant, the 27.
27.
Yes, sir.
So you have 8, you need 3 additional drivers then, and this is, you only operate 1 shift now, right?
That's correct.
Okay. And you're only picking up garbage now, outside now?
Once a week.
Sometime once a week. Okay? Yes. So where in this budget is the other 3 drivers, right?
Yes.
And the other helpers?
Through you, Mr. Chair, even though we had submitted for a big increase, we were only able to obtain 3 drivers in this budget. The goal is, or the plan is, to spread the rest of the complement over 3 years or 2 years.
So we can bring in brand new trucks and park them for 2 years to get staff to drive them?
No. That's the additional, because I know, through you, Mr. Chair, there's some concern, as you just mentioned. Garbage is just being collected once a week, pretty much. And by law, yes, we are to be collecting at least 2 times per week. But with the current number of staffing and equipment, to be straight with you, it's impossible to do that.
I agree with you, sir. I'm trying to help you get the resources that you need to provide the services that the law requires.
Right.
I just don't happen to find in the budget sufficient resources in manpower for you to utilize the very expensive trucks that we're buying on a regular 8-hour shift basis, much less having another shift, which I think is necessary. I think in order for you, even with 21 trucks, in order for you to adequately and meet the requirements of the law to pick up every household garbage twice a week, you are going to need to operate at least 2 shifts, 2 8-hour shifts per day.
Yes. Through you, Mr. Chair, I agree with the member. I mean, for us to really get back to the service twice a week, we definitely need twice as much personnel in order to facilitate 2 shifts to accomplish that. Just to add, Mr. Chairman, there's been a lot of creativity as go on in the last, at least since I've been there in the last year, because we have been utilizing temporary help, as you mentioned, and we've also been utilizing private providers where we can. In addition, I had to reach out to the prison director through their ROTL program to see where they can provide us additional personnel to help us out. We don't want to be in a position constantly where we have to exercise our creativeness. So yes, we do need the additional help because, we understand our role as it relates to our contribution to the tourism pillar in terms of cleanliness. So it's important for us to get the resources we need in order to fulfill our goals.
And Mr. Chair, I commit to doing whatever I need to do. And the government will give me their full support to do whatever is necessary to ensure that DEH has its full complement. This has been something that it's of national concern. There's been a lot of embarrassment over the past few years, I must admit, that for the past year since the new director has gone there, at least the equipment that we have now, that we thought was no good at all, has somehow been upkept so that it can be utilized until the new equipment come. So whatever this government needs to do, I can commit that we will do whatever is necessary to ensure that DEH has the correct complement for the drivers of garbage trucks and assistants on the wing.
Member for Newlands.
Thank you, Mr. Chairman. Mr. Chairman, I've been listening closely, and while I hear what the minister is saying, I feel for him. And he said that the government is prepared to do what it takes. Why aren't we doing it now? That's my question. Because, Mr. Chairman, I mean, we prioritize other things. We put the money in other things. This is affecting the people. This is affecting our constituents. It's a health risk. It is something that we can't just put off. And while I know resources are limited, it is a priority. We have a dengue outbreak. We might have some other outbreak if we don't deal with it. So, I think the people have been patient long enough, and all of us get the complaints. We just need to put the resources where they need to be.
I appreciate the members' support for this, and I too want to see this resolved.
Mr. Chairman,
Member for,
I will
you'll
yield
defer
to
to
the
him?
leader opposite. Yeah.
Okay, and then I have to get back to the member for Northside.
I don't know if they're going to respond.
Minister, you're consulting, or are you going to answer the questions before on the floor?
Mr. Chairman, if I may, I don't know. 2 years ago, I suggested a solution to this equipment shortage problem. Why hasn't that been employed, or that wasn't good enough idea? Because, Mr. Chairman, this minister is not the first minister that has had problems with the collection of garbage. I had it too. And I repeat again what I did. I went out and engaged trucks and picked it up and dumped it off at the dump until 5 or 6 garbage trucks could arrive on the island. Why aren't we employing those kind of solutions to the problem of garbage collection?
I believe that the director did say they use private collectors as well from time to time. But the minister has made certain commitments here as well with regard to the personnel and whatnot. And what I would say to the committee is, as Minister of Finance, that we will take a look at it and we will see what we can do to resolve this issue fairly quickly. And I'll make that commitment. Member for Northside.
Yeah, on a different topic, or while they're busy trying to sort that out. Recycling.
Question, sir?
Through you to the minister, are any of the new garbage trucks equipped for recycling, i.e. picking up plastics in one bin, glass in one bin, paper in another bin, or are these just general garbage trucks that put everything in one bin?
Through you to the member, Mr. Chair, they are a mixture. like I said before, the front-end loaders, which deals with the commercial pickups, and you have the rear loaders, which deals with the residential. And there one particular truck which we're buying as a pilot. This is a side loader, which will mostly be operated by one person. So it's a pilot. We're hoping to see how that works out.
What I'm asking is, right now, you have bins in front of the Civic Center, which we're going to get to that next, right? Because that's a wrong place to have garbage bins. They're overflowing right this morning to where people bring recycling material and they put them in different containers. My question is, are any of these trucks equipped to pick up that material in separate compartments? Or are these trucks going to do what we do now? We just dump it into the regular garbage, or we I don't know whether we clean the garbage truck out before we send them north side, and all of the recyclable stuff goes in one bin?
Through you, Mr. Chair, to the member, these particular trucks won't have the separation. The side loader, we're trying to spec it to be such. But currently, the other trucks that we're using to pick up the recycles, they're normally cleaned before we send them out to pick up the recyclables.
Again, I haven't seen 3 trucks come to the Civic Center to pick up recyclables. I see 1 truck come there, but they're 3 containers. One is plastics, one is paper, and one is glass. But I get the distinct impression that they're all picked up by the same truck.
Through you, Mr. Chair, to the member, if that's the case, I will have to look into that, because that shouldn't be. There should be separate trucks collecting the separate recyclables. But that's something I'll give an undertaking. I'll look into.
Okay. If you're going to go to side bin, you're going to have to change all of your containers that you currently have collecting recyclables, right? Because that side bin truck can't handle those size bins that your front end loader is picking up now.
Through you, Mr. Chairman, the current side loader that we're acquiring, the specification for the handle are going to be designed such that they can pick up from your 30 gallons to your 55-gallon bins. And the residential, they'll be residential. But it's not specifically designed for commercial. That's what we're trying to make sure, that the handle are designed such that they don't have to do that. They can pick up any size, any shape. Because if you start to go down to the size and shape, then you have to change the bins.
Okay, currently the recyclable container for Northside is in the front of the Civic Center. I called up 3 or 4 months ago and made a suggestion that we move it from there and put it across the street on the property that's partly filled in, that government owns, just below the edge, right? But for some reason, it is still there, and I'm almost safe in saying that unless my personal assistant calls a report that it's overflowing, nobody bothers to come pick it up. And it can get in a very disgraceful state in front of the Civic Center.
Through you, Mr. Chairman, we did look at relocating the bin. The site that you recommended, I think there were some issues with it. In terms of not just the turning radius, I think there were the stableness of the location. That's what I was told from the team that went out to look at it. But not to say we have given up, sir. We are still looking at our options in relation to that.
Can I invite you to come and you and I look at it? Because
certainly,
I don't know where they looked at, but it has some fill on it, not that it needs to be flattened out.
Right.
But the area is, the excuse I was given was that they were worried about the CUC wires.
Right.
But CUC wires are in the road reserve. And the piece of land is that the area that's filled in now is probably 100 by 150 feet.
Yes.
So it's quite a lot of space there if you just level it up and compact it a little bit.
We can have a look, sir. No
Thank you.
Just to answer your other question in relation to why these things are being overrun in terms of, it's the same problems we're having with these trucks. At times they're down, unfortunately, and we don't get to the bins as often as we would like to. But hopefully, once these new trucks are in, we certainly will see some improvements.
If I could make another suggestion.
And they're on a schedule, but when it's off,
yeah,
we have these problems.
A lot of the recycling is being done by people who live in the Caymanca area. And I would be a good suggestion if we put some bins at the Kaibo Public Beach, but you need to hurry because it's washing away. Because they come all the way up there to do it, and then all the other district, the whole district also put stuff there. Because there was a point when it was being done by a private company. There were bins in the Caymanca area, there were bins at Chisholm Shop, and etc. So there were a number of places. So I think we need to increase the places that we have recycling opportunities if we go and get serious about it. And also, I don't know whether you've been told, but the public beach that is being, on which the bathroom facilities and stuff is being built next to Starfish Point, there was a request from the community that when they were designing the garbage area for that included recyclable containers as well, for the same purpose, for the same reason. So I'll come pick you up and carry you for a drive in a nice truck.
Member for Georgetown Central.
Thank you, Mr. Chair. Firstly, I want to say, Mr. Sims, you're doing a good job. I know it's not an easy task, and sometimes things are limited or hurdles get in your way, but keep it up, and I'm proud of you so far in respect to your post and everything you're doing. That being said, through you, Mr. Chair, I want to ask the Minister, in light of what we've heard so far about, preparing for the new trucks and staffing, as well as what we've heard over the last few days in Finance Committee of potential projections for increase in numbers of people on the island through work permits and the like, are we prepared to handle the waste collection in Cayman?
Through you, Mr. Chair, to the member, first of all, thank you for your kind compliments. As we can all appreciate, the Cayman Islands is a growing population. We've seen homes, developments going up everywhere, commercial and residential. And so this is a start of, for us trying to improve the new equipment to keep up. I can tell you, yes, we are at least 10 years behind in terms of keeping up with the population growth and our collections. At least 10 years we haven't grown. The Department of Environmental Health has the same staff complement as it had 10 years ago. So,
forgive me, Mr. Chair. Did the director just say that we were about 10 years behind in respect to garbage collection processes? Or staffing?
No, to you, Mr. Chairman, not the processes. In terms of staffing, our numbers haven't changed. Our equipment haven't changed. Like I just say, I've taken over DH with the same personnel, the same equipment, nothing haven't changed. But this is a start now where we're now, thanks to the minister, we have gotten funds to purchase equipment. They're not here yet, but they have been purchased. They have been purchased and deposits made, and they're in development now. So we're getting there. So I'm very hopeful still, even though things are the way they are at the moment. I would say give it 6 to 8 months. We should be able to see some level of improvement.
Mr. Sims, if I could just interject here, just from my own knowledge, didn't we buy a lot of equipment in 2015? No. Don't tell me we did. I know we did.
We thought they were ordered, Mr. Chairman, in 2017 when we came in here. That minister told me that this was under new management. I said the lead time on that equipment was 18 months. We still haven't ordered them.
No, but I know because I attended our commissioning back in 2015.
Well, you wasn't no minister then.
I wasn't a minister, but I attended. I know we got new equipment. That's all my point is.
Right. You were the minister for right, and you ministered in 2017. In 2017, after the election, when we were told that the equipment would be ordered, and I said it's going to take 18 months, try find other ordinary trucks to pick it up in the interim. That minister told me, under my tenure, it used to take 18 months. This was a new regime, and this was new management. Not come yet, 2.5 years.
Mr. Chair, I hate to say that the member was right, and I have voted the funds for the purchase of garbage truck 3 times now in my 2 years.
Chairman, give the minister his due, whether that's good, bad, or indifferent. But it wasn't all his fault. It wasn't Richard's either. No, Richard just gone there, and he just got dumped in on it. But I just want to ask Richard one question since we're here, Mr. Sims. I mean, to pick up on Mr. Miller's thing about the recycling stuff, you need compartmental trucks. So they need hydraulic arms to pick up those bins, whether they're 55 or not. Why don't we get at least one of them in order that we don't have to go and lift these drums up and throw them into these side load trucks? Yeah, one of the hydraulic trucks.
Yes, Mr. Chair, after a presentation to caucus, I made a presentation to caucus in terms of what I'd envisioned whilst we were ordering garbage trucks, that I wanted us to have a different approach and to try a pilot project, which the director agreed on. And we have ordered one of those trucks. So when the trucks arrive in March or yes, one of them will be coming. But we have to do it in we have to run a pilot project in a specific area or something for us to be able to gauge, because this has never been tried before, in the efforts of trying to encourage recycling. And this would be on different days from when the regular residential garbage would be collected. So in essence, we would be picking up almost twice a day, twice a week, but not the same type of garbage.
Well, Mr. Chairman, I appreciate the minister saying that, and I welcome that. But may I suggest that we order 200 of each container, which is 600. We're looking at 600 containers. When I was there, we did a complete study on it. And mind you, I carry my copper home, you know. Okay. And order 200 of each, because it is usually the people who come live with us that is more concerned. They're so accustomed to it where they came from. and we can do the pilot with them in much of those residential areas, and they have their three containers out by the road, and the truck goes and pick them up and dump it in. And just do that. They're not that expensive.
Yeah.
Maybe $50, $30 a container, maybe something like that. We were getting them for like $6 or something.
Yes, the member, Mr. Chair, is perfectly right. My advice and
Coming back.
was to also order the bins, but I didn't exactly know what type of equipment or the name of the truck or whatever. Mr. Sims did the investigation after me letting him know the vision, and found out that you could actually make adjustments to the arm, etc., and it could possibly work with other bins, which was very encouraging. Then we wouldn't have had to expand that money. But the initial thought was to buy the bins and have them color coded, that everyone would know once it's a blue bin out that is the recycling bin, and everyone would be instructed. That's why we set a pilot program in a certain area, so we could actually get all the kinks out and move from there to other throughout the whole island.
Mr. Chair.
Member for Georgetown Central. Go
Thank
ahead.
you, Mr. Chair. I want to turn now to in the budget statements in respect to EVH 18. I think there might be an error there in respect to some numbers. We talk about how many miles of streets receiving litter collection. And I was just trying to examine the numbers of whether we're increasing collection of garbage. But I see that in 2019, the number is only 696, and projected for 2020 and 2021 to be 4,000 to 6,000. Maybe there's an error from the predictions from 2019. I can't see us going from just under 700 to 4,000 miles of collection. So maybe there's a missing 0 or 1 or something. But that's not my question. The question is to the minister or the director. The tons of waste that is projected to be collected is up to 20% more than it was in 2019, and up to 24% in 2021. What is the reasoning behind that projection or that prediction that the increase will come up so much? Based on the tons of waste we're collecting, because we're going from this year of 54,000 to potentially up to 68,000 next year, and then up to 71,000 in 2021. So we must be making those predictions based on something. What caused the predictions?
Through you, Mr. Chairman, to the member. What's driving those numbers up is what we're seeing in terms of the numbers of garbage being disposed of at the landfill. As I mentioned earlier, you would realize that the population is growing. More constructions are happening. So there are more waste being generated. Currently, we're seeing, waste at the landfill anywhere between 90 to 100,000 tons a year. So, and with the increase in population, that number is expected to grow.
Thank you. Just
Member, members will notice that the ministers had to step outside very briefly. He asked if we could take a 5-minute break, but he had to rush out before you could complete. So if everyone just remain in their seat, we'll wait the return of the minister. South Central, you can continue now with your questioning.
Thank you, Mr. Chair. Just almost wrapping up now. Can the director says exactly what we were just talking about, recycling and the different types of collections, and we're trying to manage that process to eventually get to an efficient way to collect recyclables. Can you explain to the country exactly, once it is collected, what actually happens to it?
Through you, Mr. Chairman, to the member, to answer your question, what happens to the recyclables once collected? We process all the recyclable at our plant, at the landfill, sort them, and just to make you and the public aware, we are only interested when it comes to at least the plastic side of things, number 1 and 2 plastics. So we don't recycle all plastic, only number 1 and 2. I have a team of persons who
Mr.
would
Director, sorry to stop you there. Can you just for this honorable house as well as the listening public, can you just get a quick example of what a number 2 and number 1 is? If that's okay.
Well, the thing is, it's hard to kind of describe plastic in so many different ways. But for example, this bottle here, I think that's a number 1. But there are several types of plastics, and they can go from number 1 to 7. But our staff are trained to sort them out. And once they sort out the cardboard, plastics, and everything else, we ship them out overseas to a company in Florida who buys them from us at a very minimal cost. So we do make some profit from it, but not much, albeit not much, but it's something.
Thank you. And it's fair to say that on most plastic containers, there's some sort of indication. I think there's a marker, like a triangle of some sort, that indicates what kinds of plastics they are, right?
Through you, Mr. Chairman, to the member, that's correct. There's a recyclable logo that are on each plastic container with the number indent in the middle.
Thank you. I just want to make sure that we as a country who's listening can get an opportunity to play their part. Moving on now to the ISWIMs through the minister. I just want to secure, because we've heard earlier today about redundancies already of some Caymanian positions, and I want to just see if we can get assurances that regardless of whatever solutions we find with the ISWIM's PPP, that it's not going to affect employment of the current Caymanians who work at the dump right now. Can the minister confirm that?
Mr. Chair, I've been assured that there will be no loss in employment.
Thank you so much, Mr. Minister. One last question and I'm done. Can the director say whether or not there's been any policy discussions or intentions for drafting to eventually get Cayman to a stage of mandatory recycling for residential and commercial in the Cayman Islands?
Mr. Chair, the ISRIMS is the project that we actually have to get off and running, and we are doing a good job, and we're at a good place now in achieving this. Unless we get the proper facilities, and once we get the waste energy facility, one of the components will be recycling, and at that point, then you'd be able to mandate or to put greater emphasis on recycling.
Member for Savannah.
Thank you, Mr. Chairman. Just a few questions to the Minister. Periodical and driving on the road, it seems like people just throw out bags about that size. What you do about the enforcement or penalizing these people? It used to be what, $500 for littering or something?
Mr. Chair, that is a very vexing situation, and the whole of caucus is committed to increasing fines. We are also thinking about putting, which is sad, but putting more personnel in different parts of the country, especially in the tourist areas, to ensure that this litter is collected as soon as possible. It's very disappointing that people throw these items. I mean, I go on these cleanups annually. They clean up day, and the amount of garbage that we collect from the sides of the road is ridiculous. But we're with you. The government is with you. The Premier has mentioned many times that we need an aggressive plan for littering. We need more signage. I've actually met with the Rotary Club. Yes, the Rotary Club, and they want to partner with the government in terms of getting a comprehensive litter plan for this country. And I see recently the Chamber of Commerce has just developed some new bins around the country also. So there's a joint effort going on, but we know that it's a major problem and we need to do something aggressive about it.
Thank you, Mr. Chairman. Just continuing to the Minister, is there a tentative date for the capping of the now existing garbage dump? And what happens, what will happen after this is closed? Where will we put the garbage?
Mr. Chair, what I've been briefed so far, and the actual capping of the landfill is quite a process, and the material that is put on it is probably some 5 or 6 feet in depth, different levels, with layers. It actually stops the leachate in the North Sound because the rain can't penetrate the actual dump that's there. While that's being capped in the area, the northwest area, and this is in conjunction of the new waste to energy facility being built in Tangent at the same time. A holding area is planned to keep the regular landfill garbage while we're capping the actual main landfill, while we transition over to the new facility, which we hope to be able to deplete at least 95% of our garbage. But it is, if you wanted more technical details, we do have the technical staff in the building, and we could provide them if you wanted.
Member for Northside.
Through you, Mr. Chairman, the garbage containers at Clifton Hunter High School are your front-end loaders with the cover. And where they're located towards the front of the school, is there any possibility of getting one of the compactable containers there? Because again, they are often overflowing because of your, inability with the equipment to service them. Whereas a compactable container, you could probably only pick it up once a week. I mean, in the last 2 weeks, I have spoke to the minister, as he's aware, on 3 different occasions, and when I went this morning, they were full again. So if you have a compactable container that you can put there, it would solve a number of problems. The garbage wouldn't be exposed, right? Because it doesn't take very much wind to lift up that little rubber cover. Okay. The second question, Mr. Chairman. The new waste management system, there has been long protracted negotiations after the bid was accepted, or at least the deadlines for the bid. Was one of the 3 companies that bid actually selected and offered a contract, or was the protracted negotiations because no bidder was selected, but some sort of consortium came out of it with which government has been negotiating now for about, must be 2 years, close to 2 years?
Mr. Chair, I would allow the project manager to respond to the honourable member.
Hi, I'm Jim Schubert, and I'm the Senior Project Manager for the new ISWIMS project. Through you, Mr. Chairman, there were 3 bidders. One of them dropped out. We had 2 submissions, and we selected a preferred bidder and a reserve bidder. So we've been negotiating with the preferred bidder since PB.
Information that has come to me suggests that the negotiations has been about increasing the price beyond what was bid. Is that so? And how much, now that the negotiations has finalized, is the new negotiated figure above what was originally bid on the RFP?
Through you, Mr. Chairman, there has been no increase. The overall net present value of the project has remained the same over the time frame. It's been negotiating technical items, negotiating a number of logistics, functionality of the whole process, and it is a 25-year project, so there's a lot of things that we need to discuss and agree to before moving forward.
So the final agreement is the figure that was submitted with the bid?
Yes, the overall price is the same.
Okay. Why was the decision made not to mine the existing dump and reduce the size of that mound, which we could probably reduce it to somewhere between 80 and 90%, and it's going to be left there as a mountain capped? Why was the decision not to mine the mine, to provide fuel so you could have a bigger waste to energy plant?
Through you, Mr. Chairman, that decision was made when we were doing the strategy about 3.5 years ago, through consultation with neighboring communities, The decision to mine or not to mine, so to speak, was made back then, and we are mining the landfill, or will be mining the landfill for methane. So part of the capping process is to collect landfill gas that is there, so we're going to get the energy content out of the landfill. But the mining piece, going back to that, was never to get it back to ground zero. It was only going to, call it, shave a portion of it off at the landfill. And the ongoing nuisance of mining a landfill for the next 20-some years, it's not like fine wine. It doesn't get better with age. So the decision not to create more nuisance was made at that time.
Why would it take 25 years to mine it? And certainly information that I have suggests that the volume would be substantially reduced, because in most of that there was a rule put in from 1989 that every day the garbage had to be covered by 3 feet of fill for the same reason, because of the neighborhood and the flies and everything else. So a large portion of that is fill, not garbage. And I just don't understand why we're going to leave that mountain there when we could mine it down. And there are techniques to mine it which can reduce all of the inconveniences for the neighborhood. And if you put in a big enough waste-to-energy plant, and if the waste-to-energy plant is not big enough to make returns, the system ain't gonna work. And the whole idea was that you'd be able to mine that to fuel a larger waste-to-energy plant until the daily municipal garbage was up to the level that could drive the thing. Because the people need to understand that if you're going to cap that, it's going to remain there, and it's always going to be a threat for explosion from methane gas unless it is very, very, very carefully managed on a daily basis.
Those are good comments through you, Mr. Chairman, but that decision that was made at the strategy part of planning not to mine the landfill, and we, as mentioned again, we will be mining it for landfill gas, which is the explosive component in the landfill, and it will safely, that's been done in hundreds, if not thousands, of landfills throughout the world.
But that methane gas carries with it a substantial risk if a leak develops and it's not monitored on a regular basis.
Through you, Mr. Chairman, that may be part of the smell. Personally, I have not smelled the methane or landfill gas smell other than close to the landfill. The smell you're smelling, unfortunately, is not the landfill gas. It's decomposing waste. But once the landfill gas collection system, the whole landfill, if you can envision it, will be entombed, capped, and it will be under a negative pressure. So it'll be like a large vacuum cleaner pulling the gas out. So it's a very safe way of mining that gas.
Does the capping include vegetation?
Yes, as through you, Mr. Chairman, as the minister mentioned earlier, there's a number of layers, and the top layer would be a vegetative layer.
But I remember as you or the minister mentioned leaching into the North Sound, which the capping is going to prevent. Do we now have evidence that the dump is leaching into the North Sound?
Yes, through you, Mr. Chairman, the landfill is not lined, so it has been leaching since day one. We have measured it. It was part of the strategy. We do have an ongoing monitoring program. The good news around that is we don't have really any heavy industry here. So the level of leaching or contamination is not as bad as we may have in other areas that have a heavy industry. So by capping it, we will be reducing the amount of leachate going into the landfill, because now moisture won't go through the landfill, but there will still be a small amount of leachate going through, We have an ongoing program that will continue to be done annually to ensure what levels are actually coming off of the landfill.
In 1989 or 1990, the then head of the Department of Environment dug a number of monitoring wells around the compound. And the consultant firm that designed the changes to the landfill for that plan, one of their recommendations was that we should keep the landfill in the same place for two reasons. One, the soil that was there, because of its calcium base, was almost like a Sears water filter. And that in itself was absorbing a lot of the leachate plus the mangroves themselves. So I'm surprised that there is now evidence that it's leaching into the North Sound, and it would be interesting to see some of those measurements and what the levels are.
Through you, Mr. Chairman, that's available information. We can share the reports that have been done. I believe our consultant, Wood PLC, looked at all of the monitoring results throughout the years. I don't believe, it's well before my time in 1989, but there would have been leaching. There isn't a liner there, so there would have been leaching at that time as well. It's the level of contaminants going through.
I know there's no liners there, so the liners which was supposed to have been bought in 1994, we put the first liner and it came on in 1991. But and you said there is property there that can accommodate the recycling plant and the waste to energy plant without having to reduce the footprint of the existing dump.
Through you, Mr. Chairman, there are lands nearby where these new facilities will all be co-located as an integrated solid waste management system. So we will not be locating them other than a residual waste landfill, a new lined residual waste landfill to take what's left over from those facilities at the Georgetown site.
Where is the location for that residual landfill going to be? On the same site?
Through you, Mr. Chairman, that's correct.
Okay. But you should have, because I bought the 40 acres in 1989 from Bill Wallace Borden for the recycling plant and the waste energy plant.
Member for Borden Town West.
Thank you, Mr. Chairman. Just want to start with just the revenues. I couldn't help but notice that there was a decrease in the revenues collected in garbage fees, which is on page 339 of the planning estimates. I noticed it dropping from roughly 3.1 million forecasted for this year to 2.5 million next year and 2.6 million the following year. I'm just curious as to what's driving the decrease in expected revenues in this for this department. Thank you.
Mr.
Through you, Mr. Chairman, to the member. The reason for those costs is revenue. Thank you. The reason for the revenue decrease is simply because we have outsourced some of the commercial collections. That's because we had no choice, because our units are always, in most parts, are down. So we had to seek additional help. And so by outsourcing, well, not real outsourcing, by allowing people to move their garbage on their own, No, no. The technicality around that is because when you allow people to go to move it privately on their own, the law says that they can approve for them to move it themselves in private vehicle. But the issue is, the technicality with that is, you find that once that permission is granted to the company to move it themselves, then we no longer can collect that revenue because they're doing it themselves. So they then seek the assistance of the private collectors who do that and pay them. Technically there's nothing really wrong with that because it's just a way to circumvent the law per se, but we can give them approval for them to do it themselves.
Thank you very much. So just so I'm clear, because this vote is net of revenues collected, we have to vote an additional $1 million over the next 2 years because your department will be collecting $1 million less in revenues.
Through you, Mr. Chair, the thing is, we're hoping for that to change, because remember, these approvals are only temporary. And so once we have our equipment and our staff, and then we can then start to improve on our efficiencies, and you'll see a difference in that.
So just to understand then, so for the private companies that would have gone out now and have made this investment in this equipment, you're basically saying then that with government taking it back, how are these businesses then expected to survive, or having made this capital investment on the basis that this is a service that they are providing?
Well, through you, Mr. Chair, that's a personal decision for them. We don't regulate them. We appreciate what they're doing for sure, and because they're assisting us now. But there's no definite commitment to guarantee them that sort of business.
To you, Mr. Chairman, in that situation, doesn't the law require you to contract a private provider to provide a service for you, and the business still pay you the fee? I'm pretty sure that's what the law said. You can only waive the fee if the person is approved by you as a recycling agent, not for general garbage at supermarkets and stuff like that, unless the laws change. I know that the commercial entities take that position, but that's not the legal position as I understand it in the law, because they're saying, and then they've been trying this for years, because they pay somebody and they believe they can pay somebody cheaper to do it for them, they don't want to pay the government fee. But I could be wrong, but as far as I recall, the law is set up in such a way that if you need assistance from people who can provide, from private companies that can assist you in picking up garbage, just like the member for East End said, did you contract with that person to pick up the garbage for you, but the commercial institution still has to pay government the fee. There is no power in the law to allow you to exempt them from paying the fee.
Through you, Mr. Chairman, there's nothing in the law that says that the fees cannot be paid. The only technicality is the fact that once permission is given to the companies or individual for them to do it themselves, then the fees no longer be required to pay to the government. That's how it reads. It's not, and so that is where the technicality exists, where they can then now go out once that approval is granted and hire these private entities and pay them.
I invite you to quote the section of the law that you're referring to, because I am not, but section 10(8) says the member of cabinet charged with responsibility for finance, where he is informed by the director that he is satisfied that the occupier of any premises is complying to the director's satisfaction with the conditions of any recycling scheme carried out by the department, may abate the fee in respect of any garbage and refuse disposal collection that would, apart from this sub-regulation, be due and payable by the occupier of premises at which that collection is carried out. And that's the only place in the law that I can find that anybody has any authority to waive any fee. I'm not saying that was
Through you, Mr. Chairman, if I may, the section that we use to grant this permission, if I could read it to the member, it's taken from the Public Health Garbage and Refuse Disposal Regulation 2011 revision, section 4. And it reads, the use of garbage collection service in service areas is mandatory, save for the large commercial establishment specifically exempt by the department. Large commercial establishment may deliver garbage and refuse to private vehicles to landfill disposal sites designated by the department. All garbage and refuse from service areas shall be disposed at a landfill site designated by the department. Save the permission in writing of the department. The burning of garbage at private premises in service areas is prohibited. No garbage or refuse shall be permitted to accumulate in or any premises. All commercial concerns shall provide the proper storage of all garbage and refuse, prevent and harborage and vermin, and prevent scattering by animals or by wind. All approval shall be from the department prior to construction of any of these special types of garbage, refuse storage bins, etc.
And I agree with you entirely, Mr. Director, but fee is not mentioned there. All that section says is that you can authorize a commercial institution to collect their own garbage and take it to a spot that you said they must put it, but it don't say nothing about waiving no government fee.
Through you, Mr. Chairman, I didn't say we can waive fees. There's no fees. I cannot. I don't have the authority on the law to waive fees.
So, but the response to the member for Bordentown West question about the reduction in revenue was that because you have some private providers, some people who make garbage out of the commercial thing, are hiring private organizations, companies, to pick up their garbage and bring it to the dump. They are not paying their fee to government. I think the law says they still have to pay the fee, because the only person can waive the fee that I can find in the law is the minister responsible for finance, and that is only on recycling. And that was specifically put in there to encourage recycling. So you need to collect all that money from them people, and they want somebody else to carry it, that's fine.
Sorry.
And I know you inherited this, and we had this argument 3 years ago.
Through you, Mr. Chairman, I couldn't help but notice that the director had mentioned in his one of his earlier responses that his staff complement had remained the same and his number of equipment had remained the same. One of the things I was curious about is looking at the compendium of statistics. I saw where the number of houses between 2010 and 2018 went up by over 5,200. So, and that's just houses alone. That didn't include buildings or anything else. I am curious, through you, Mr. Chairman, to the Honorable Minister and on to the Director, similar to what the Ministry of CPI is doing in terms of these overarching long-term strategic plan, like the National Infrastructure Plan, the National Energy Policy Plan. Is there an overarching national waste management collection plan that looking at the areas of growth, looking at population, looking at where they're going, in terms of looking to see how we're going to manage this in the future going forward, and pretty much not be caught off guard as we have in some instances?
Through you, Mr. Chair, the simple answer to that, sir, is no.
That's fine. It is what it is. One of the things that we had touched on earlier also was the issue of the different types of plastics. Now, we have seen some countries around the world looking at banning plastics altogether. The question is this something that we're also entertaining or even considering looking at, considering that the overall market for disposing of plastic or recycling plastic is basically decreasing?
Mr. Chair, what I can say to the members, on December 4th, we have our second meeting of the Plastics Steering Committee. It's quite a large committee. We tried to get a lot of stakeholders in, supermarkets, etc., and even small mom and pop shops, and jerk stands, anyone that we could include. We didn't leave out anyone. And I can tell you that I have a great appetite. We saw the presentations from the school children, and again the members of the East End Primary School that came in the Honorable House today reminded me when I went upstairs to greet them that if I remember that they had wrote me about banning plastics in the Cayman Islands. And I think as a country, we need to continue inspiring our youth to appreciate that their voices are being heard. And we need to do whatever we can to secure this country for them in future years. So I right away, if I had my way, I would have banned certain type plastics already, but I was restrained by my ministry to wait on the committee to make some recommendations. But I see some of the supermarkets already started doing some plastic reduction and move to paper bags. So there's certain things that we could do immediately. There's some low-hanging fruits that possibly at the next steering committee meeting next week that could be announced before Christmas of initiatives that we're doing, and most likely we'll give our stakeholders the lead time that is necessary to be able to adjust to the new policies that we're adopting.
Thank you very much, Mr. Minister. Just one final question. One of the things I noticed in one of the vote was the whole public education. And we have all seen and read where with the trade war between the US and China and the overall decrease for recyclables, which the Chinese no longer demanding. And so we have seen that market beginning to not be what it was before. I mean, at some point we have to realize that, I will say it, recycling is dead to some extent. And I mean, the question in all of that to you, Minister, is that in terms of when can we start looking at expected where we can have an overarching plan that we can start looking at our own problem internally, because ultimately our ability to shift this problem or ship this problem elsewhere will actually be reduced in years to come. I mean, what is the ultimate solution that you see long term?
The ultimate solution is ISWIMS and just burn.
Mr. Chairman, if I may.
I hope I said that right.
Mr. Chairman, I must tell you, we laugh about that, but
That's true.
that was my approach too, for mass burn energy. But with a component of recycling as well. But may I say to the Minister, Mr. Chairman, I heard him go on a little bit about plastic use. I took the world on in 2010 in Trinidad about that. And I see where they have another sustainable development conference now in Malta. I've just applied for that too. I want to go there too, to deal with them there. And them lords up in England as well. We like to talk about single-use plastic, the plastic bags. And my presentation in Trinidad at that time was, really? We're going to ban plastic bags in supermarkets, and we carry our own little bags. What do we put in those bags? Everything is wrapped in plastic. Okay? I want to meet with the kids that went out on the lawn, made presentation to you, I believe. I want to do a paradigm shift for them and for us all. There's no such thing as low-hanging fruit. The only fruit we get now, this is them wrapping plastic already. It is one fruit, whether it's high or it's low. We banning all plastic now. We did it for renewables and say we want 70% by such and such a time. Well, we want 100% of plastic removed from this country by such and such a time too. But you know the problem? Too many interests spoiling the pot. That's the problem. One plastic bag is not going to help us. The response from them, the scientists were, we start someplace. Let's start right at the top and wipe them all out. That's my view. Maybe my view is wrong, Minister, but that's my view.
All in favor of HES 7, collection, recycling, and disposal of waste?
Mr. Chairman,
I did not give you your opportunity,
I've been
did I?
hanging here for a little while.
All right. Go ahead, sir.
And I wanted to respond.
I'm the low-hanging fruit.
I'm trying to help you enough. Go ahead, sir.
Mr. Chair, I just wanted to say to the honorable member, I invite his passion, and I guess the only thing we need to be cognizant of is that we import everything, you know, and so that's why we need to move gradual, I think. Yes.
Member for Newlands.
Thank you, Mr. Chairman. I'll be quick. We were talking about littering previously, and I know the minister said that he's going to throw some resources at it, which is good news. What I was, no pun intended, what I was going to suggest or ask him if through you is if they've considered doing something similar to what we did with the iguanas, offer a reward, an incentive, because we all see people littering. I see it all the time. If there's a reward system that results in prosecution, then I think more people would be apt to report what is going on and illegal dumping, all that sort of stuff.
Mr. Chair, I like that suggestion, and we need to find a way. I've thought about trying to have like a WhatsApp number that people could just snap and send it in, send in a picture or license plates, etc. Videos. These are things that we've been discussing. But I remember back in the 70s, I don't know why we regressed, but back in the 70s, we used to pick up Coca-Cola bottles and we would get 5 cents a bottle, and we would pick up Winston-Salem packs of cigarette, and we would get one of those old bags that we used to go get mangoes in. So we were recycling from back then and getting paid. So there needs to be some incentive is where I'm going at. And this is some of the things that we discussed also in the first steering committee, plastics.
Mr. Chairman, I support the minister in his view, but most of us in here, with the exception of a few little young ones,
grew up in a world where it was only paper bag. The only thing we used were paper bags. No, sometimes they were used for other business. And we were. And now they're killing us. No, it looks like we can't win, but there is a fact that this country, the time and cultures evolve, so does time. But we got to put some controls on it. We have to put some controls. And people's behavior, there was a moral obligation on all of us in this country to keep this country clean. Nobody threw anything out the car. God forbid I'm going to go look in my truck out there now. But, you know, that's what it was. And when you hear a siren or you see a blue light, first thing you do, look on your speedometer to see if you're driving too fast. People don't care anymore. The rule of law has gone out the window. Literally, they're throwing it out of the window.
Member for Newlands, one last question.
Last one. Mr. Chairman.
Forget styrofoam and you're banning plastics.
Oh, yeah.
This may be
order, please.
Some old ground that I'm recovering, but I don't think we've done it in this meeting. Especially on the eastern side, the eastern districts, up around Manch Road, Bartontown, that area there, the beach. There's constantly garbage washing on shore, constantly. Every time we clean it up, it comes back. Do we have any idea what the source of that is? Is it cruise ships?
No, I wouldn't just leave it out there that is cruise ships. There's a myriad of ways that garbage is floating into this country, as I've been briefed from other countries too.
So, final question: are we going to engage the new Coast Guard in actively enforcing, patrolling, making sure that no one is dumping garbage, with at least in Cayman waters? Because the quantity that I see coming up there on a constant basis, it has to be actively someone dumping that. It isn't just casualish washing in here bit by bit. That's a lot of garbage, a lot of plastic, and it seems to be stuff that it wouldn't be coming from anywhere like Haiti. I've been told maybe Haiti was the source of it. I'm seeing some American garbage, if you get what I'm saying.
Mr. Chair, if I can beg your indulgence for one, please, sir.
He needs to answer. We have a question on the floor. I don't know.
Mr. Chair, thank you so much for your patience. I just wanted to ask the director, who should be quite familiar with the ISRIM's plan now and the whole capping of the landfill. We heard recently in the last couple of days that the government is taking the approach of a new ministry for travel, which was quite similar to the UDP administration under the then Premier McKeever Bush. This seems yet again like another policy that he had in plan with the capping of the landfill with the gas and all that is being taken up again. Is this capping and gasification and all that basically a copy of what he planned back then again?
Remember, there is no Ministry of Travel.
Sorry, I didn't mean Ministry of Travel. A ministry that was be doing a lot of traveling, exposing Cayman. The minister, I think it was a Minister for Foreign Investment.
What's the relevance to it with garbage collection?
All I was just trying to establish, my question was, is this plan the same plan that was back when the United Democratic Party's administration was in. That was the question.
I don't believe there's anyone here that can answer that. Good. All in favor of HES 7, collection, recycling, and disposal of waste. $6,097,107 in 2020. $6,279,338 in 2021. Standing part of the schedule to the bill. Please say aye.
Aye.
The aye. Those against, no? Ayes have it. Turn now to HESH, Public Health Services, $2,345,536 in 2020, $2,445,045 in 2021. Questions? Member for Northside.
Through you, Mr. Chairman, part of the description under this is health awareness and school visits and promotions. Can the minister tell me when is the last time anybody from this department visited the 8 Mile Primary School or the Clifton Hunter High School?
Member, sorry for the sidebar, but members, the discussion I was having with the leader of the opposition is he had let me know at this stage that the opposition need to leave at 6 o'clock. And my position is I had intended to move forward to get as much, if at all possible, get this ministry completed today. I can't do this, and if I'm going to be persuaded to shut down Finance Committee at 6, I really need to move and get most of this, if not all of it, approved. So, I mean, I'm happy to...
Mr. Chairman, I have a solution for you, sir.
Go ahead,
They
sir.
can give me the questions and I'll ask them from.
I'm happy to take the vote. I mean, gentlemen, please, I need some help here.
No, Mr. Chairman, the member from West Bay West has an ability to move motions to put the question. He has practiced that a long time, but you know, I've never subscribed to that. We are always willing to assist. Yeah.
Member, can we see what we can get through?
Okay.
I mean, if there are
All right,
jobs there that you want me to take,
Mr.
I need
Chairman,
you to indicate so we can take those
here's
votes.
what I promise you that I will not engage, but these young people need to engage, and you know, I am going to leave it up to them. And you know, Mr. Miller, this is his subject, so he needs to engage.
Continue as normal.
Mr. Chair, can I make a suggestion? While the members still here, if we can indicate which one of these we could, if any, take in block.
That's what I'm asking them for, is for the indications here. But I mean, I'm not,
That
honestly,
may be helpful.
the time that we're going to take now, if we shut down at 6, this has to be finished then tomorrow to push everything back further into next week. If that's the case, then I'm happy for us to continue and stay. And let's get it done.
Mr.
Okay.
Chair, Mr. Chair, just for purposes of note, and I don't want to be difficult in any capacity at all, right? But didn't we break at 6 o'clock sometime earlier this week for other reasons?
Yes, and I gave indications from earlier that we would be.
Okay,
I mean, I had no idea until it was said to me at 5 o'clock
Okay.
that you all needed to be away. I had planned to, my team here had been planned to be here late to get this taken care of today. Okay, so, I mean, I'm going to continue with the vote.
Mr. Chairman, it all boils down to a democracy. You can't control the head with the tail. If we were in the government, we would be the head. They're the head, the majority rules. And however, there has been much in this country said that we need to work with the government. We need to work together. I don't hear anybody government need to work with us. This is where I'm throwing that out because I have been working with the government and being reasonable. It is of absolute importance that the opposition.
Members, if I could have your attention now. Can I ask you, can you indicate to me which numbers we can take here in block and vote? Or if you let me know what this particular areas you want to examine, and let's see what else we can block vote that would give us the majority of this stuff to get through. I'm happy to, but I don't think we can come back here reasonably expect another day tomorrow to do it. All right.
Chris, that he like an eagle on that audit, and that one out there, that one.
I don't think there's any question.
Very careful one. Let's go. Go ahead, Mr. Chairman. Proceed, Mr. Chairman.
Mr. Member for Northside, you said you had a question on the floor. Yep. Okay, please repeat.
This subhead HES 8 talks about environmental health awareness and promotion to the public and government. And on the quantity, it says there are 30 to 35 school visits or promotions planned for next year. My question is, when was the last time did somebody from this public health services go to the Aidan O'Moyle Primary School or to the Clifton Hunter High School?
Lizette Yearwood, CEO for the Health Services Authority. Mr. Chairman, through you, I cannot give you the date of the last visit to the Aidan O'Moyle School, but I do acknowledge that although the program is surpassing all the measures that are included in the output, we are consistently challenged to reach all of the schools, both public and private, equitably, because we have more schools coming on stream all of the time.
Own edification. You sure that this is your vote? Because I believe more this has to do with environmental health, because it talks about air quality and stuff like that, unless the HSA is now monitoring air quality, et cetera, so.
Mr. Chairman, through you, I was of the impression that it was the school health nurse that
No.
that you were looking at visiting the school. Okay.
That's later on, not coming on the
Okay,
HSA.
I'll defer it to whoever else. Is it you? I thought we finished with you.
HSA taking over rodent control in rats too? Just asking.
Through you, Mr. Chair,
Go ahead, sir.
my apologies, I didn't realize that was for me, but Mr. Chairman, I cannot say to you specifically what dates we visited Northside, but our communication officer did visit the schools. However, she's since resigned the post, and the post is currently vacant. We should be advertising in the new year because there were some amendments to the requirements of the post, which was updated by POCS. So we will be advertising in the new year.
That would be in relation to education and public health and cleanliness, et cetera, right? What about the air quality assessments? We have a temporary classroom that has been known to have been infected in the past, so I want to know when last have you gone and checked the air there? Number of indoor air quality assessment conducted and reported, 30 to 40.
Yes, sir. Can you repeat the question for me, Mr.?
My question is have you been to the Mile Primary School within the last year to look at the air quality, particularly in the temporary classroom that exists on the compound?
Through you, Mr. Chairman, I don't have that record at the moment, but if we do, I'll certainly supply it to you. And if we haven't done so, I can give an undertaking that we will do so in the new year.
Thank you, Mr. Chairman. I'll take the undertaking ASAP. When I pick up my truck, we'll go there too.
Other questions?
Yeah.
Member for Bodden Town West.
Thank you very much, Mr. Chairman. I noticed that this vote covers EVH 11, and just for the listening public and everyone listening, the description for this vote says development and engineering services, including environmental health impacts of projects, review of plans, and recommending certificate of occupancy, housing and related accommodation, also cemetery management and capacity planning. With that said, Mr. Chairman, through you to the Honorable Minister and on to the Director, have there been any plans or anything developed, and pretty much when was the last time one was done? Page, you have budget documented here?
To you, Mr. Chair, can the member repeat the question itself? So, to you, Mr. Chair, I just want to be clear on your question, though. I have succeeded.
I'm trying to understand what it is, in a nutshell, what it is that this spend covers, and in essence, what have you guys done lately with it? What have you done with this money?
Okay, through you, Mr. Chair. This spent is for, inspections as it relates to planning inspections for pools. We also do inspection for certificate occupancy. And as it relates to the vaults, construction and inspection of vaults.
Sorry, I'm just trying to understand the part that says environmental health impact of projects. I mean, what does that environmental health impact covers? What does that entails?
Through you, Mr. Chair. This is in relation to the wells at the landfill. We have to monitor the wells and doing sampling and so on. Yeah.
Member for, my apologies.
Yeah, through
Go
you,
ahead, member for Northside.
Through you, to the member and the director. This vote is where you build the vaults and stuff, right? Okay. We have about 4, might be as much as 6 vaults in the public cemetery in Northside that public health built some years ago, which are all less than 3 feet deep. And you can actually push your hand under the first row blocks. And I doubt very much that anybody in my constituency are ever going to use them. I tried some time ago, about 4 or 5 years ago, to get the director at that time to condemn the vaults and knock them down and rebuild proper vaults. I'm asking you to look at them because I don't think any of my constituents are going to use them. And they're occupying space, and in fact, one row of them basically blocks the entrance of the cemetery. So they really need to come down and rebuild proper vaults. And isn't there a regulation that covers the constructions of vaults to certain standards? There is. It should, but it was. I know that because I wrote it.
Through you, Mr. Chair, to the member. We do follow the specifications for the construction of walls. Once contracted out to private companies to construct, we do supply the plans for them, and they have to follow them, and we do inspect prior to finalization of them.
And I don't know if you might have it there with you, but do you recall what the depth of the vault is supposed to be? In sand.
Through you, Mr. Chair, the vaults are normally 6 feet.
That's what I thought. And there's also a specification included there as to the width of the seal seam around the lid.
Through you, Mr. Chair, that's correct. That's 3 feet.
No. You know, when you put the lid on, there's a seam that they fill up with cement.
Yes.
And the reason for that is because some people were putting cork in it. That's why we had to write the regulation.
Right.
And I noticed that some of the ones that you are contracting to build, I believe it's supposed to be 3/4 or 5/8 of an inch or something like that.
Yes, sir.
Right.
That's correct.
Are substantially narrower.
Yes. 3/4.
Right. And the ministers who bury the people are not always making sure that the straps are removed, which is also, I believe, part of that.
Yes.
So you might want to look into seeing that, but we'll go look at the ones that I'm talking about. Thank you very much, Mr. Chairman.
Member for Georgetown Central.
Thank you, Mr. Chair. Can the minister say what happens to a report made by the public of a health concern with a food and restaurant provider? What happens if a member of public says something has happened that is inappropriate from a health perspective about a restaurant or a food provider? Food poisoning, for example.
Mr. Chair, it's not in this vote, it's in the next vote. Could you defer it to that?
Well, I don't mind deferring it to the next one, but I would disagree.
Likewise,
I would
the cemeteries is not in this vote either. It's in HES 7, but we answered that. But
well, if you look at HES 8 and look under what the budget outputs are, it falls under EVH 9, which deals with food and safety and hygiene surveillance, which description is inspection and surveillance of food establishments, including food recalls, foodborne illnesses, local meat inspections, and training of food handlers. So it has to fall under this line item.
yeah, this one talks about complaints, so we'll allow Mr. Chair. The director will go ahead and answer.
Through you, Mr. Chair, to the member, I can assure you, sir, that when it comes to those sort of complaints, the department take them very seriously. Because as you can appreciate, the Cayman Islands have some of the best high-standard restaurants in the Caribbean, and serving some of the best foods, right? So therefore, we have to manage those carefully. If there are serious threats found that is prejudicial to health, to the well-being of consumers of any food establishment, such as serious vermin infestation issues, that will no doubt contribute to the spread of foodborne illnesses or diseases. The excrement of these vermin are found in foods, as you described. If there are any breaches in the sewage line resulting from inundation of food preparation, right, in the dining area or in immediate grounds, for example. If there's foodborne disease outbreak where numerous people are affected, then any of these can contribute to the closing of such a facility. However, though, the DEH will request the proprietors to initiate the closure. If they don't, then I will have to thereafter consult the medical officer for health, the MOH, who has the authority to issue the closure under Section 22 of the Public Health Law.
Thank you, Director. I didn't want to suggest that there is any concerns in our wonderful island that offers such great cuisines, but just for the listening ear in this chamber and outside this chamber, how the process is dealt with so they're comforted. Sometimes you hear a few things on social media and the like, but I'll move on. That was a well-informed answer. I think you may have covered this, Director, through you, Mr. Chair, about the promotion of education on recycling in the schools. And I hate to be redundant or repetitive, apologize, but do you do that in all the schools? Promotion and education of recycling.
Through you, Mr. Chairman, we are certainly making our best efforts to ensure that we continue to promote the importance of recycling. We understand that we are not a nation that came up into recycling as such, but we have to continue to educate so that we can change behaviors. So we're on the path of doing so, but I'm sure it will take some time, but we'll continue to do so, and especially with ISWIMS coming on board, we have to make sure that the public is continually educated.
Thank you, Director. Through you, Mr. Chair, and I would offer the assistance of myself from Georgetown Central in any capacity to help you with this, because it's a very important part of the process for us to move into a different way of dealing with waste. I know we're not there from a legislative perspective yet, but as we continue to educate our young people, eventually we'll get to that stage. So if there's anything that I can do to assist that department and this government, I am willing to help. Just two questions, Mr. Chair, left. In respect, can the Minister give an update on the mosquito control unit in respect to the fight against any concerns relating to dengue? I know that there was a special effort to go out pretty strong in the community to do a spray. Can you give us an update on where we are with that?
Mr. Chair, is it something in particular or that relates to DH, or is it something that we can do under HES 11? Or?
Forgive me, you are 100% correct, Minister. It is under a different line. I'll ask the question later.
Okay. Yeah, we just want to get through this one and try to progress as quickly as we can.
All in favor of each.
Sorry, Mr. Chair. I just want to ask the Minister, and it might be better for the last item to be voted on, but I just want to make sure he has the staff available to answer the question at that time. But I defer to you, Minister. But it's to do with the update on the West Bay Cemetery. I know it's this department, but whether you want to take it now or when you want to take it when we vote on the actual vaults on EA 30. But I certainly would appreciate, as well as the other members from the West Bay District and the listening public, an update as to what is happening with respect to the build-out of the cemetery, the new cemetery, that is.
Mr. Chair, I want to thank the Honourable Minister for the question. And we can comment on it now. I'd also need the help of the Honourable Minister for CPI. Apparently there's just got a update on this yesterday, and they're waiting for CPI to prep the site preparation before we can actually start construction of the vault. So there has to be some communication between the two ministries to achieve this. I don't know if and there has been communication. We're just waiting for confirmation as to when they'll actually start the works, site preparation.
Who will plan there? Mr. Chairman, just before we move on, because discussing of Mr. Chairman.
All those in favor of HES 8, Public Health Services, $2,345,536 in 2020, $2,445,045 in 2021, standing part of the schedule to the bill, please say aye.
Aye.
Those against, no. The ayes have it.
Mr. Chairman,
Yes, member for Buttontown West.
can we get a quick 5-minute break? Everyone can stay in their seat. We just want to discuss something amongst ourselves. And
5-minute break it is. For everyone else remain in their seats, please. If I could draw everyone's attention now, back to proceedings at hand.
Mr. Chairman, thank you very much for your indulgence. I have spoken to my colleagues on this side, and we have agreed that we can take the following items as a block vote. HES 19, HEA 19, HEA 21.
Hang on. HEA 19.
Yep.
21.
H 21, 23.
Go ahead.
24, 25, 26, MUS 4, MUS 5, MUS 6, NCF 7, NCF 8, NCF 9, NAG 1, NAG 2, NAG 3, NDC 1, NHD 4, NHD 5, NHD 6, NHD 7, NGS 4, NGS 74, NGS 83, TP 44, TP 73, OE 15, OE 66, OE 103, EI 23, EI 47, EI 72, and EA 30.
Thank you very much, sir. That's enough to ask for no more. I would not even think of it, sir. I just want to thank you very much. Okay. I am going to, at this point, take the vote on these items, and then we will close proceedings down for the day. Now, member for Bodden Town West, I have one further favor to ask of you, sir.
What's that, Mr. Chairman?
Just follow with me, and if I miss anything, you
Oh,
let
don't
me
worry.
know.
We definitely will.
Okay. So I'm going to put these matters to the vote. All in favor of HES 19, Policy Advice and Awareness Program, $205,500 in 2020, $205,500 in 2021. Standing part of the schedule to the bill, please say aye. Those against, no. The ayes have it. HEA, all those in favor of HEA 19, medical care for chronic ailments, $775,608 in 2020, and $775,608 in 2021. HEA 20, public health programs, investigate. No, we said that, we skipped that.
Yep.
HEA 21, medical internship program, $150,000 in 2020 and $150,000 in 2021. HEA 23, provision of antiretroviral medication, $492,000 in 2020 and $492,000 in 2021. HEA 24, provision of psychological trauma diagnosis and treatment for children, $100,000 in 2020 and $100,000 in 2021. HEA 25, management and maintenance of cancer registry, $38,666 in 2020 and $38,666 in 2021. HEA 26, adolescent mental health program, $840,000 in 2020 and $840,000 in 2021. MUS 4, collection and preservation of significant material evidence, $147,744,000 in 2020 and $147,744 in $744 in 2021. MUS 5, museum facilities, exhibitions, and displays, $575,928 in 2020, $575,928 in 2021. MUS 6, provision of policy and general advice on museum matters, $131,328 in 2020 and $131,328 in 2021. NCF 7, arts and culture preservation, documentation and promotion, $99,873 in 2020 and $99,873 in 2021. NCF 8, national festivals and stage productions, $877,338 in 2020 and $877,338 in 2021. NCF 9, training and support for artistic development, $111,589 in 2020 and $111,589 in 2021. NAG 1, exhibitions and collection, $209,940 in 2020, $209,940 in 2021. And NAG 2, National Art Collection, $120,620 in 2020 and $120,620 in 2021, all standing part of the schedule to the bill. Please say aye. Those against, no. The ayes have it. I did the two NAGs. I got more to go though. We come in. I'm just doing it by page number. All those in favor of NAG 3, art education and outreach programs, $405,440 in 2020 and $405,440 in 2021. NDC 1, policy, prevention, surveillance research, information, monitoring and evaluation, $689,355 in 2020, $689,355 in 2021. NHT 4, administration of the Affordable Housing Initiative, $239,934 in 2020, $239,934 in 2021. NHT 5, administration of the Government Guaranteed Home Assisted Mortgage, $231,031 in 2020, $231,031 in 2021. NHT 6, administration of the New Affordable Housing Initiative, $187,368 in 2020, $187,368 in 2021. NHT 7, administration of the Build Your Own Property Initiative, $16,667 in 2020, $16,667 in 2021. NGS 4, HIV/AIDS and First Aid Public Education Programs, $39,325 in 2020 and $39,325 in 2021. NGS 74, preservation of natural environment and places of historic significance, $570,000 in 2020 and $570,000 in 2021. And NGS 83, other health and cultural programs, $40,000 in 2020 and $40,000 in 2021, all standing part of the schedule to the bill. Please say aye. Those against, no. The ayes have it.
Mr. Chairman, sorry, HES 18, we'll miss that on the first page. You did 18? HES 18? Okay. He started at 19. I think you need to do 18.
We can do 18 as well?
No.
Okay. We did HES 19. And that's the only thing I had identified on the first page. So just to confirm, only thing left on page 31 is NGS 53 and NGS 55. Okay.
NGS 83, NGS 74. Mr. Chairman, did you mention NGS 74? Yeah. Did you mention that?
Yes, sir, I did that.
And that's in the block vote?
That's in the block vote.
Well, can you please tell the National Trust that we're giving them $570,000, not for them to go take that money and sue us with? Can you send that message to them?
Mr. Chairman, the lawsuit is this year. This is money for next year.
Listen, I have 5 minutes left. No, sir, I got all in favor of TP 44, temporary poor relief payments for young parents program students, $30,000 in 2020 and $30,000 in 2021. TP 73, other health and cultural program assistance, $482,500 in 2020 and $482,500 in 2021. OE15, Pan American Health Organization subscription, $15,000 in 2020 and $15,000 in 2021. OE66, United Nations Caribbean Environmental Program, $7,000 in 2020, $7,000 in 2021. OE103, Caribbean Public Health Agency, CARFA, $18,500 in 2020, $18,500 in 2021. EI-23, Cayman Islands National Museum, $300,000 in 2020 and $50,000 in 2021. EI-47, Cayman National Gallery, $60,000 in 2020, $150,000 in 2021. EI-57.
No. EI-72.
72 is the next one.
Okay.
You gotta make
Fair
sense.
enough. EI-72, Cayman National Cultural Foundation, $30,000 in 2020, $180,000 in 2021. And EA-30, Cemetery Vaults, Grand Cayman, $100,000 in 2020 and $100,000 in 2021. All standing part of the schedule to the bill. Please say aye.
Aye.
Those against, no. The ayes have it. We've taken a vote on HEA 18. $19. Okay. Members, that then concludes the business for today. We will convene again tomorrow morning at 9:30.
Mr. Chairman,
Yes,
I think
sir.
you can tell the civil servants who heard their votes already voted on that they don't need to come back tomorrow.
That was
Okay.
something I was going to deal with right afterwards, but just letting everyone know we meet at 9:30. And as the member for Northside has indicated, those of you that civil servants are here whose votes have now been taken, you are excused and
Mr. Chair.
Mr. Chair.
Yeah, I want to, I want to thank the staff for coming out. Those votes that have been confirmed already, for all the hard work that you do, and the ministry for all the hard work that the ministry does. I must say I want to thank the opposition under the leadership of Bordentown West. Sorry. No, well, you were the person who orchestrated or brought the group together, and with the approval of the opposition leader. Okay, sorry, my bad. But I want to thank the opposition leader for orchestrating the block votes.
You don't have to thank me. You just thank the opposition.
Yeah.
Because this.
That's good enough. Don't worry about it. You've been here long enough. Just come tomorrow with less questions.
Members, we are adjourned.
Mr. Chair, on behalf of the opposition, we too also would like to thank those civil servants who came here today to bear with us. And so, no. I think it's only fair that the opposition get their word too, huh?
Says to cancel this year's Sounds of Love Thanksgiving benefit concert. The event was scheduled for November 30th at the East End Heritage Field, but has been canceled now. Officials from CMEA, though, wanted to send out their heartfelt thanks to the many people who plan to participate